Hi, my name is Angela Clark, and I'm going to be describing my poster presentation on neonatal abstinence training, use of inter-observer reliability testing with the Finnegan scoring tool. Maternal substance abuse in pregnancy is a growing perinatal problem. Drug-exposed infants often are diagnosed with neonatal abstinence syndrome as a result of these withdrawal symptoms. After birth, providers can use guides like the Finnegan scoring tool to help assess and identify those infants with withdrawal symptoms. The ability by providers to identify these symptoms early has been shown to help prevent delay in care for infants with NAS who may require pharmacotherapy and intensive care. Infants with NAS have longer hospitalizations, which also increases healthcare costs. In 2009, the estimated cost for total hospitalization for these babies was over $720 million. An average length of stay for them was 17 days and 23 days for those who actually required more treatment. The plan is to develop a program at Baptist Health Lexington that starts by using the Finnegan scoring tool to identify all 21 NAS symptoms so that all staff understand the criteria. Next, create a program for inter-observer reliability testing to help demonstrate that nurses are consistently scoring the same infant at the same time with the same score. This helps to increase confidence and validity with using this screening tool as part of an interprofessional collaboration plan. There will be 3 separate assessment points to check for inter-observer reliability: a pre-test immediately prior to training, a post-test immediately after training, and then another test between 1 to 3 months post-training to check for retention of training education. A DNP nurse can help establish this NAS inter-observer reliability testing program to be included as part of the unit mandatory education structure. Expanding NAS training will help support the organization's mission, vision, and values by helping to ensure that nursing care for infants with NAS is evidence-based and performed accurately with a minimum goal of 90% inter-observer scoring once training has occurred. Part of the NAS program will deal with training nurses on providing non-judgmental care to women with addiction, which will promote respectful, compassionate care to these moms and their infants. Since Baptist Health Lexington already owns a copy of the DVD and manual for the Neo Advances NAS Inter-Observer Reliability Testing Program, the additional cost to purchase a single-site video license would be $940. This would be considered a capital expense as part of a long-term investment. Manuals cost $60, so an extra 20 manuals would cost $1,200. As part of operational expenses, the hospital already owns much of the needed components. Training would occur in a unit conference room in the organization where there is already video and computer equipment. Printing cost for the paper test would be approximately $50 for 500 sheets of paper at 10 cents per sheet. There are about 63 mother-baby, 70 NICU, and 10 pediatric nurses who would need this training. With a mid-range average hourly salary of $32.66, this would amount to approximately $9,340 for the 2-hour training program. All nurses would need to complete the pre-test and post-test during the training time, and then a 1 to 3 month follow-up test could be accessed online at the organization and completed during a regularly scheduled staff meeting. For future use of this training program, the neonatal nurse educator could assume this into her educational role for the units each year. A SWOT analysis reveals strengths that the organization actually supports NAS advanced training for their nurses. There is an increased national attention to the opioid epidemic. This can help improve nurse confidence in assessment. And also, this is a public demonstration of excellent NAS care. Weaknesses for the program can include reallocation of budget funds for this increased educational training. Nurses may feel overwhelmed with something else that they have to learn how to do. One additional training session may also not be enough to keep that inter-rater reliability score greater than 90%. Opportunities include that there is a current provider in the organization who has a maternal substance abuse program, and his patients will deliver at the hospital, which will in turn have more infants needing the NAS scoring. Women then may also choose to deliver at this hospital because there's known excellent NAS care. Threats to this program include that another large hospital in the area already has an expanded substance abuse program for the moms with a rooming in unit. Women may choose to deliver at that hospital if they perceived increased support for their infant bonding. Timeline for this program includes starting around January 22nd, 2018 and ending June 4th, 2018. Starting with meetings with the directors of the hospital, distributing surveys to the nurses, reserving the unit education rooms, providing that NAS training, doing the post-training 1 to 3 months, analyzing all three's data scores, and then disseminating the findings to the hospital. An inter-observer reliability rate that is 90% or greater is recommended for those performing infant assessments, particularly those who may not observe those infants very often, along with new staff who are less familiar with the tool. The idea is that inter-observer reliability rates would improve after training. If the pre-assessment scores are greater than 90%, that's still useful for the organization because you want those levels to stay high even after training. Information noted in the pre-assessment survey may be used to generate future research ideas. Some examples of outcome measures could include more infants scoring less than 8 while remaining with their mothers, decreased number of NICU admissions for NAS babies, and decreased days of hospitalization. Thank you.